Welcome back, everybody. We are in the middle of what I consider the heart of these sessions, trying to help you form your opinions about whether psychiatry and its medicalization is really correct, is really going to help us, help those in distress, and help our society go in the right direction. I want to continue with some material that, again, would not be very likely that somebody outside of medicine and psychiatry would give thoughts to these kind of things. But yet they're not difficult to really understand. And so I'm urging you, do not be intimidated by this kind of material. Don't think that you're not able to compete with somebody, let's say, who has a medical background. Once these concepts are introduced and you think about them, you are on the same grounds as anybody else. In fact, in my judgment, and this is not just smooth talk here, I really believe you will be in a better position to form a valid and well thought out opinion if you are not one of the people in these professions, because biases creep in when you're a part of something. The fact that I have all these opinions, I'm part of it. My critics will say, sure, Coleman's a good example, so be it. But don't be intimidated. You're most likely not a medical person, not a psychiatric trained person. All the more reason why you can give these ideas a fresh look. What I'm talking about now is this concept of making a diagnosis in the mental health field. The biologically oriented profession now of psychiatry, something that has only developed with this tremendous financing in the last 40, 50 years, is claiming that the diagnosis is critical. And we've all agreed that in medicine, it is critical. That is where it's at, finding the cause. Then you have a hope of finding a treatment, because you can know whether or not the treatment is addressing the cause. Now, if in fact psychiatry cannot find the causes in the medical sense, that is, it has not been able to find any medical disorders which are the causes of mental problems, it means they cannot diagnose people. That doesn't mean mental health professionals and programs cannot help people. In fact, what I'm going to argue now, and try to help you see what you think about it, is that the attempt to diagnose people with mental disorder problems is actually making it far worse. It's not a good idea to be stuck on this concept of diagnosis, given the fact that a diagnosis is a medical concept. Now, real medical doctors who are practicing real medicine, cardiologists, dermatologists, etc., they can legitimately narrow their focus of attention to the specific problem that the person comes in with. Is that the way to help human beings with the problems that they have, to narrow your attention just to a so-called disease? The desperate attempt to find diseases has sent psychiatry in the wrong direction, because so often psychiatrists are simply looking which label is in a book, and I'll pick that label and I'll pick what they say is the right thing to do to the person's body for that alleged disease. There is another way to help people, and it's not to narrow down your attention, but to broaden your attention, and to broaden the kind of people who you ask to assist. So they're not necessarily always talking therapists. They might be people who assist in the environment of the person, social support, community support, advocacy with community agencies, etc. No simple solutions. I'm not going to give you any quick recipes, except to say that when you don't narrow your attention in this vain attempt to find a medical disease, and then give something you do to the person's body, the track record of that is hardly very encouraging. Now, let me give you some examples of how this approach works in medicine, effectively looking for the disease, and how the language is legitimate and how it goes the other way. In medicine, for example, you can speak of the patient's disorder being in remission. Terminology, in remission. And I think most of us know that means that the disease is being controlled. The patient is having less symptoms. And most importantly, the physiological and biological measures which allow you to make the diagnosis in the first place demonstrate an improvement, possibly even an apparent disappearance of the disorder. Now, if you can't find any evidence that the disease is still there, you may say the disease has been cured. If it turns out you were wrong, you would then say, well, it was in remission because it came back. But that's always dependent on having medically, scientifically based information that the disease is either present or it isn't. Imagine then, what would it mean to say that a mental patient had, let's say, schizophrenia in remission? That is a completely illegitimate use of language. Number one, there's no verifiable scientific way to say the person has schizophrenia. You can have the opinion that they have the kind of pattern which we associate with that: irrational thinking, incomprehensible behavior, other symptoms, and that problem is real. But to say it's in remission because you think the person still has it, but it's just been controlled, that's what the term would imply, can have the most devastating consequences to the individual. I think of the example of a man who'd been in San Quentin prison for 25 years. The parole board refused year after year after year to grant him parole, despite his long having served a sentence way beyond any kind of appropriate sentence for his crime. But because at some point earlier, a psychiatrist had applied a label, schizophrenia, and there's no test for it, he had not shown anything that anybody would identify with that condition for decades. But because each psychiatrist who came along a year later than the last one, etc., it's safer to keep the diagnosis instead of going out on a limb and saying, I don't think he has it anymore. He was getting labeled schizophrenia in remission. And by the time I interviewed him, he'd been in there over 20 years. And the parole board would look at that and say, but he still has schizophrenia. We can't parole him if he still has schizophrenia. So you have a bogus so-called diagnosis in the first place, schizophrenia, as a so-called diagnosis, and then in remission added to it, and you now have oppression of the most unholy sort. Another thing by the use of this in remission is that once that label is applied, and I've seen this decade after decade, once a psychiatrist applies a particular diagnosis, it's the standard for the next psychiatrist to keep the label. It's safer that way. Because somebody could say, oh, you changed, you don't think he has it anymore? Well, I think he does have it. And since there is no test, there's no medical evaluation, people will simply say schizophrenia or manic depression in remission. Major depression in remission. You never lose the label. I think of it as like a fish hook. You put that fish hook in your finger and you try to manipulate it, and about all you do is get it in further. So these medical labels have consequences. If the label is bogus, the consequences can be not only wrong, but they can be devastating. What would it mean to have a label in remission applied year after year after year, then every time a psychiatrist sees the person, they want them to stay on the drugs? And if there is no medical disorder that caused the problem in the first place, and we're not going to assume there wasn't a problem, a serious problem, then there's always a rationale for keeping the person on the drugs decade after decade after decade. So language is important. I talk to people, even though I'm no longer seeing patients, but people ask me about these things. They might say, oh, my sister is a manic depressive. And how is that different from schizophrenia, they might say. This is an actual conversation I had just a few weeks ago. And what I always say is, you know, when I hear you say that your sister is a manic depressive, I know that you or the people you've been talking to have been fooled by the language. If you say somebody is having periods of excessive, manic-y, hyperactive behavior, using bad judgment, and then other periods of being very depressed, then I'd say, okay, I can tell you how that's different than what is meant by schizophrenia. The person's not overtly irrational with manic depression. But when they say, my sister is a manic depressive, like, I am a boy and she's a girl, or I'm an American and you're French, when they say, my sister is a manic depressive, I know there is no thing in their body which allowed somebody to say, this is what you are. They're talking about how somebody is behaving or how somebody is being, how they are feeling or acting. And that makes a huge difference in how you are going to see yourself. So the harm of this language isn't always because somebody is strapped down and given electric shock treatment. It goes to how they see themselves. It goes to what they may agree to having done to them by a psychiatrist because of misinformation, misunderstanding. So this whole medical model is doing tremendous harm in more ways than just the so-called treatments. It goes to how we attempt to help people. It goes to how people see themselves. It all goes to how they are stigmatized by these labels. And that's something we're going to talk about next time, is the stigma that comes from falsely claiming that people with mental problems have a medical problem. The consequences are far too great to allow psychiatry to keep doing what it's doing with the blessings and the cheering of an all-too-rich pharmaceutical industry, governmental agencies like the National Institutes of Mental Health, professional societies like the American Medical Association and the American Psychiatric Association, to continue to dominate this field. Next time, we're going to go to an example where the major media in this country became virtually the cheerleaders of this same kind of manipulation. We're talking about 60 Minutes and a segment just recently done promoting electric shock treatment with absolutely no investigation of what's really going on there. Please come back, and thanks a lot for coming.